So I chose to do my project on stem cells and Alzheimer's. So I chose to do this research project because my aunts have been diagnosed with Alzheimer's disease and my grandmother had Parkinson's. And although Alzheimer's disease is not necessarily genetic, there is a higher chance of developing the disease than those who do not have any association, familial-wise. And it seems as though I may be heading down the same route, so maybe I did this research project a little bit for myself, just to see if this is something that would benefit me when it got to that point. So my question is, can stem cells help stop the progression of Alzheimer's? A little background on stem cells. Stem cells are cells that can develop into many types of cells. They serve as a repair system for the body. There are four main types. There's embryonic, tissue-specific, mesenchymal, and induced pluripotent stem cells. They have been used to help treat spinal cord injuries, diabetes, Parkinson's, Alzheimer's, heart disease, stroke, burns, cancer, and osteoarthritis. Mesenchymal stem cells and embryonic stem cells are most commonly used for cognitive disorders. Stem cells can grow into brain cells and may have the potential to repair brain damage caused by neurological conditions. Alzheimer's is a progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest of tasks. Brain connections and cells themselves degenerate and die, and there are more than 50 million people who are diagnosed, and it typically affects those who are 60 and older. So there are 7 stages of Alzheimer's. The first is when there's barely any detectable symptoms. The second is there's maybe some slight memory loss, but it's usually chalked up to old age. The third stage is when people close to that affected person will notice small things. The doctor will be able to determine that the patient has impaired cognitive function. The fourth stage is when there are clear signs of Alzheimer's disease. The person affected will forget simple things such as life details, what they ate for breakfast, and will even have trouble paying bills. The fifth stage is moderately severe decline, so they will need assistance with day-to-day activities, they will be more confused, but will maintain motor function. They can also still use the restroom and bathe themselves independently. The sixth stage is when constant professional care and monitoring need to take place. So they will be unaware of surroundings, unable to use the restroom or clean themselves alone. They will form behavioral problems and will forget people's faces. The seventh stage is, unfortunately, when the patient is nearing death. They will lose the ability to communicate and swallow. Alzheimer's itself will not kill someone, but the decline in brain function will. So my hypothesis is that stem cells can help stop the progression of Alzheimer's disease. So for this experiment, I would get 60 people aged 60 and up, as this is when the disease starts showing up. Half the group, or 30 people, will receive the placebo, and the other half will get the stem cell treatment, either embryonic or mesenchymal. It will be a double-blind study, as those types of studies prevent bias, and it also improves reliability of the results. I would have 10 people from stage 4, 10 people from stage 5, and 10 people from stage 6 for both the placebo and the stem cell treatment groups. I chose these stages as it's right after the Alzheimer's diagnosis is confirmed and right before all motor function and mental capabilities are lost. Having a range of stages will help determine when the most effective time for stem cell treatment is and when it is too late. Patients will be tested on their memory recall abilities and motor function before the treatment, during their treatment, and after treatment. The dosage of stem cells depends on the stage of the patient. Usually people need 3 to 16 doses over a span of time to see any effect. Again, the number of treatment rounds depends on the patient and amount of neurological damage. Stem cells are injected intravenously because of the control it provides over the dosage, and it is also more direct. So the patients also need to be monitored as they are still affected by Alzheimer's disease and the treatment is not immediate. They also need to be watched in case there are side effects to the stem cell injections. Side effects include mouth and throat pain, nausea and vomiting, infection, administration site reactions, headaches, and/or chills. Patients will receive monthly PET scans and blood tests. PET scans are favored in this case as they use radioactive tracers to highlight amyloid protein plaques or abnormal cell clumps in the brain. And these are the characteristics of Alzheimer's disease. The blood tests are to make sure everything else in the body is within normal ranges. The total cost for the whole experiment will be around $7 million, give or take. This includes the cost of stem cell extractions, stem cell injections, PET scans, blood tests, equipment, and the tests, cognitive and motor tests for all 60 people. There are a few ethical concerns, one of which is getting the consent from both the donors of the gametes and embryos as well as the recipients of the stem cells. Embryonic stem cells are donated by women who have fertilized eggs in clinics that will not be used. Mesenchymal stem cells can be harvested from amniotic fluid during cesareans. If they are not used, they will be discarded as medical waste. They can also be collected from bone marrow, adipose tissue, or umbilical cord. There was a trial for human nervous system stem cells on mice with Alzheimer's, and there was a significant improvement with mice who are not taking the placebo. Although Alzheimer's is not naturally occurring in mice, scientists study mice that have been genetically modified to produce high levels of human amyloid protein. The mice had better scores when it came to place recognition and spatial memory. Using stem cells to treat Alzheimer's disease is fairly new, so there are no published graphs on human trials. That being said, animal trials have been getting positive results. Although animal trials cannot be directly translated to human studies, it is a step in the right direction. Okay, so this graph shows the result of mesenchymal stem cells on people with Parkinson's. Although Parkinson's and Alzheimer's disease are not the same, they both affect cognitive and motor function. The results of this clinical trial show that those taking mesenchymal stem cells have improved function over time. As of right now, I cannot say if stem cells can stop the progression of Alzheimer's disease, as there are not enough results or human studies. That being said, it does look promising, and there should be a more definite answer in the near future. Okay, so this video is one of the very few published pieces I found. It is from a regenerative medicine center. It's a pretty long video, but they have started using mesenchymal stem cells to treat Alzheimer's disease, and from the looks of it have had pretty positive results. So I'm confident that we will get there eventually.